Okay, class, we're back. And what we did last time was to talk about the mesentery, to talk about the peritoneum, and the structure, anatomical structure of that. Let's go a little further. Now we're looking at the blood supply to the GI tract. We have arteries, hepatic portal circulation. All right. The arteries that we have go and obviously supply an oxygenated blood. Okay. Then we have a venous circulation. Then we have an hepatic portal circulation. The hepatic portal circulation is a venous circulation. And the job of the hepatic portal circulation is to, after the person absorbs, to take all of the nutrients first to the liver. Now, I want you to remember this. That is true for anything that's water soluble. That is true for anything that's water soluble. But anything that's lipid soluble, if you recall, first goes into the lymphatics, and then from the lymphatics goes into the bloodstream at the thoracic duct. It does not go directly. Putting too much fat into the circulation would cause severe problems. So water-soluble things, which would be like your amino acids and things of this nature there, carbohydrates will go, they're water-soluble, they'll go through the hepatic portal circulation into the liver. So again, we come back and we say that going to the intestine, we have arteries. Now this is kind of when we look at it, here would be kind of the arterial supply. Now, see, here's the diaphragm here, just to show you. I'm not asking you to memorize all of this. So here would be the aorta coming down. This is the abdominal aorta coming down. Then what's going to happen is it's then going to send branches to various things, superior and inferior mesenteric arteries. See, they'll get the small intestine and the colon, the large intestine. The celiac trunk gets the liver, the gallbladder. Okay? So these right here would be what you're looking at as an arterial. Superior mesenteric, inferior mesenteric arteries. Okay? Celiac trunk. So we go here, I'm just showing you. So I'm now, the red again is the arterial. So we're coming from the diaphragm. See, here goes the hepatic artery in here. And so these are various blood vessels. We'll hit them again as we look at an organ. But these are various blood vessels that's going to go and supply the arterial supply to these, to the alimentary tract and also to the accessory structures. All right. Here is a picture to show you. See, right here, there's that celiac trunk coming, and it's supplying some of these to over here. There's that splenic artery. See, here's that celiac trunk again. Let's do the celiac trunk. See right there, common hepatic artery, splenic artery, okay, gastroduodenal artery, okay, gastro going to the stomach and the first part of the small intestine, gastroduodenal artery. So just showing you, not asking you to learn all these circulations, but to show you that blood supply that you have. Now that's the arterial blood supply. Here again is looking at it right there. Another picture to show you. Okay, that's the artery. That's very good oxygenated. Now, as I said, the hepatic portal circulation, those blood vessels are up in the intestinal wall. And what they need to do is to, once absorption occurs, see these veins here, once absorption occurs for the water-soluble stuff, they need to bring that in, and it initially goes through the liver. So here's that hepatic, this is the pure mesenteric vein and so forth like that. The hepatic portal vein formed by the union of the splenic and superior mesenteric veins, okay, formed by the union of the splenic and superior, takes blood into the liver, and the liver does it first, and then the liver will deliver it into the inferior vena cava. So all absorption of water-soluble stuff goes through the liver first. Let me say it again. All absorption of water-soluble stuff goes through the liver. But absorption of lipid stuff, remember, goes into the lymphatic capillaries and then ultimately goes into what? The trunk, right? The intestinal trunk. And then the intestinal trunk enters into the cisternae chyli. Go back to your lymphatics, and then the cisternae chyli and everything finally enters into the thoracic duct. So go back. So lipid goes first into the lymphatic, and water soluble goes into the bloodstream. Okay. All right. Now we're looking at the layers of the intestinal wall. Okay, what do we have? Let's start first with the mucosa. That's the innermost layer. That's the innermost layer. Then we go to the submucosa. That's connective tissue. Now the mucosa, then the epithelia right here is generally going to be a columnar type. And then we go to the submucosa. And then we go to the muscularis layer, circular muscle and longitudinal muscle. Longitudinal and circular. See, the intestines can squeeze, circular muscle would squeeze down and longitudinal muscle would pull up. That helps with that peristalsis and those segmentation. And then the outer part is the serosa right here. And see, that serosa is attached with that visceral peritoneum. Okay, so let's look at another picture here. Here we are again. See, right here would be the mucosa. The mucosa is going to have an epithelial layer. Okay, epithelial layer. So epithelium, then a little bit of layer of connective tissue called the lamina propria, the appropriate layer. Then the mucosa has a muscularis. It has a little bit of muscle itself, which helps to kind of, now this gives what we call rippling waves. We never talked about those. Those are kind of like little rippling waves to kind of move stuff. So that's the mucosa. Epithelium depends, but generally in most cases it's going to be a columnar. Then we go to the lamina propria, muscularis, mucosa. Then we go to the submucosa, which is really connective tissue. Then we go to the muscularis externa. Okay, and the muscularis externa has, as I said, longitudinal muscle to pull up to shorten the gut to kind of help, and circular muscle. Then we go to the serosa out here, which has a right here, which is the outermost. Okay, it's an epithelium and connective tissue to allow the sliding action. All right. So we have several layers. 1, 2, 3, 4. The mucosa lines the lumen, functions, secretes mucus, digestive enzymes, absorbs end products, protects against infectious disease. Epithelium, lamina propria, and muscularis mucosa. A little rippling wave there. Epithelium, a simple columnar, and mucus secreting cells, mucus. So there you also have goblet cells, and then you got mucus secreting cells too, but the cells primarily, if they're mucus secreting, generally are goblet cells. Remember what mucus is. Mucus, the cells secrete mucin, remember, which is a glycoprotein, and upon mixing with water you get mucus. Protects digestive organs from enzymes, because see that mucus layer, because see you're going to put proteolytic enzymes here. You're going to put enzymes that break down proteins. Well, you don't want to break down your own wall of the gut, do you? So that mucus there provides a layer so the digestive enzymes, like those that break down proteins, can't get and digest the wall. So you know that, and stress can mess with that. That's how you can get these ulcers. Stress can decrease that. Stress causes the sympathetic nervous system to kick in. Remember, the sympathetic nervous system messes with the gut, slowing it down and everything, because it's a fight and flight deal. Eases food may secrete enzymes and hormones, okay? And when we get to the small intestine and some other areas in the stomach, you'll see that some hormones can be secreted by some of these mucosal cells. Okay, lamina propria, loose connective tissue. Areola is another name for loose connective tissue. Lymphatics, the malt, mucosal associated lymphoid tissue. Remember we talked about that? Capillaries for nourishment and absorption. Muscularis that produces local movements, the little rippling waves I mentioned. Submucosa, dense connective tissue. Okay, let's go back. Dense connective tissue, what you have, lymphatic vessels in there, lymph follicles, and so forth. Submucosa. Muscularis externa for segmentation and peristalsis. See that muscularis mucosa, it's just a little thin layer of smooth muscle. It gives a little rippling action. But these are the big boys, the muscularis externa, inner circular, outer longitudinal. That's the general. Now, in the stomach, we're gonna throw in another layer called the oblique layer. Myenteric plexus. See, that's one of those. Remember we talked about that 500 to 600 kind of million neurons. Well, that's part of it. Sphincters in certain regions to open and close stuff. Okay. Visceral peritoneum, replaced by fibrous tissue in the esophagus. The esophagus has an adventitia. The reason being it attaches to surrounding things so it doesn't move around. But the peritoneum has more of an epithelial layer, which then allows it to slide. Remember that peritoneum. Retroperitoneal organs, like part of the duodenum and so forth, have an adventitia in some parts in the serosa. Adventitia sticks to stuff surrounding it. Serosa doesn't because it's an epithelial lining. And that's why, because you don't want the gut to stick to the gut, all the loops of intestine. Now just to point something out to you, when we do surgery on the intestine, and I don't care who does it, and you touch it, you mess with that epithelium, so you start to get intestine stuck to intestine. And that's what we call adhesions. That's what we call adhesions. They can be so much sometimes that it just locks the intestine down. When I was a medical student, and that was my 3rd year, I went in on a surgery. Of course, I'm just a 3rd year med school, just looking at it. And this person had several abdominal surgeries. Several. So when they went in to work on the person and opened them up, all the intestines were locked down in adhesions. It almost looked like one solid block of cement. Now here's the thing. It took them about 8 hours just to dissect those adhesions. So you think, well, if you just pull them apart, the adhesions are stronger than the intestinal wall. So if you just jerked it apart, you'd have poked holes in this thing. So those adhesions can be something else. Those adhesions can be significant. So you want this intestine to flow free. See? Okay? All right. So now we're to the nervous system. I'm going to start another one. Enteric nerve.